Hi there, this is DanaArcuri.com, and today we're going to be talking about how medicine masks the problems and different medical conditions that people have. And so I think it's interesting that there's a doctor, and this is a quote by Dr. Poonam Krishan, who says, "Pills mask, not fix, the cause of our problems." And so it's interesting that this comes from a physician. It's nice to know there are some doctors out there who totally get it. They understand that sometimes medicine is overprescribed and that some people are discovering it's doing more harm than good. So for anyone who follows me, you already know that I have a lot of videos about Cymbalta, Benzodiazepines, Prozac, Effexor, Cipro, and don't forget flying high with Gabapentin. And so you know then, if you've watched these videos, you're well aware that I've had quite a time with these medicines. And, you start off where you think your doctor really cares. You hope that your doctor knows best, especially if we're putting our health in their hands. And sometimes we find out the hard way that medicine might not be the answer. And that's what happened to me after years and years and years of being prescribed medicine, following conventional medicine, and just kind of following the doctor's orders, which gets me straight to prescribed harm. It's interesting that people don't understand that this is a real thing. So prescribed harm, what it means is that a physician wrote one or more prescriptions to a patient, and then the patient was harmed by that very prescription. And so for anyone who has experienced negative consequences with any medication, so whether it's anti-anxiety, whether it's sedatives, whether it's painkillers, whether it's antidepressants, you name it, hey, there's a whole list out there, people. And, it might even be for you, blood pressure meds, meds for diabetes or for your heart or for your kidneys and what have you. There's a long list of medications and health conditions that we have. But what's really interesting is that there's a lot of people, they don't understand that prescribed harm is happening, and there's thousands upon thousands, if not more, people across our world who are having destructive consequences, debilitating consequences where they're not able to function anymore. Some people have to get on Social Security disability, and many others are just not able to work. They're not able to be a parent, like a mom or dad to their kids. They're not able to go like day-to-day activities of daily living, just the whole eating, walking, drinking, bathing, getting dressed by yourself. A lot of people, they're not able to do that. We might take it for granted that we ourselves can just function on our own, but not everybody has that liberty to do so after the devastating consequences of prescription medicine. Which leads me to this. We have to understand that with every single prescription, no matter what it's for, that there are negative side effects. And even though it doesn't happen to you, or even though not all of the negative side effects on the list that you get from your pharmacy, a pharmacist will give you this package, and it'll have your medicine, and it'll have the paperwork, and on the paperwork it will tell you these are potential side effects and beware of this drug if you take other drugs. So it might tell you, don't mix your psych drug with your heart medicine, or it might tell you to keep them at a different timeline. Maybe you need to take one in the morning and take the other at least 2 hours later, or else you could have some really serious implications mixing this potent cocktail chemicals. So there's just always so much that goes into it. And after I've been through the Cymbalta hell, Benzodiazepine nightmare with wicked withdrawals, just debilitating consequences where I was no longer able to work and no longer able to even function when I was going through the protracted withdrawal symptoms. I mean, we're talking vertigo, vomiting, abdominal pain, panic attacks, agoraphobia, high anxiety. I thought I was dying, racing heartbeat, palpitations, just stabbing pain in my abdominal area. The room was spinning in circles. I felt like I was on my deathbed. I really sincerely questioned if that was it, like I was dying. When you don't go through withdrawals and you've never in your life experienced it, you don't know. You just don't know. And so, we have to understand that so many people are finding out that the medicine is masking the problems. So, for example, someone is suffering depression. Let's just keep it simple. They're suffering depression, and it might be just clinical depression. And so their doctor gives them, let's just say Prozac. So they start taking Prozac, and maybe for a while they are feeling pretty good. Maybe for a while they're like, hey, I feel like I'm, not doing so bad anymore. At least I'm not crying or screaming or having a meltdown, and maybe for 6 months, 9 months, even a few years, maybe they're okay. And then all of a sudden, out of nowhere, all hell breaks loose, and suddenly they start having more depression, more anxiety, and they feel like the pill just isn't working. It's like Prozac stopped working. Suddenly it just isn't doing it. And they build up a tolerance to that medicine, and it's no longer effective. And so then, they might be then going back to their doctor, and he's like, okay, let's give you some Effexor. So off they go. They're taking Effexor for a while, and another year goes by, and it's like the same story. I mean, how many people are going through this? Raise your hand, people. Give me a like or a thumbs up or comments. Tell me, please, are you going through this? Because that's what I went through way back when I was taking the medicine, like back in the 90s. And even in the early 2000s, when I was taking, Lexapro and Prozac and Effexor, and it was just like, why are these medicines not working anymore? Why aren't they helping depression? Like, what's going on over here? And my doctor was just like, hey, you could stop taking Effexor. And I'm like, are you crazy? And he was just like, just stop taking it. I'm your physician, and I'm giving you doctor's orders. Well, it landed me in the ER. It landed me in a bad way, and so, of course, your doctor doesn't always know best. And then you go back to the same thought. Could my medicine be masking my depression, or could my medicine be masking my symptoms? And so I'm here to just say that through my personal life journey, dealing with anxiety and fibromyalgia, back pain and herniated discs and so forth, insomnia, that I've found out that no, the medicine's not necessarily helping on a long-term basis. Now, short-term, I have to say, some of the medicine helped short-term. So very short-term, Prozac helped short-term, Lexapro helped short-term, Adderall helped short-term, Cymbalta did not help at all. Benzodiazepine did not help at all. That is a whole story in itself. Go watch those other videos on benzos. Effexor was very short-term. Gabapentin was a big fat joke. We're not even going to go there. Let's not go there, people. You can go watch Flying High with Gabapentin. Just watch it on your own time, at your own convenience. But the gist of this is that, people are getting fed up that medicine's like a big old Band-Aid, and the Band-Aid, it's not healing the condition. So we take a deeper look at, is it a condition like an autoimmune condition? Is it a mental health condition? For people, many people, it could be both. Because when you have an autoimmune condition, such as a thyroid problem or something like fibromyalgia, the depression goes hand in hand with that disorder. So it's a big part of it. And We want so badly for our medicines to help us, and unfortunately we can find out that it's not, and it's just covering up the symptoms, and then we still feel like shit, and then somewhere along the way we're like, wait a minute, I still have chronic pain, I still have depression, I'm still like screaming and yelling, and I'm having a meltdown, and I can't sleep at night, and my pills stopped working, and I think they're just masking my symptoms, or they're giving me new symptoms like worse depression, worse anxiety, worse insomnia. And that's what the main two drugs that really screwed me up royally was Cymbalta, which is also known as Duloxetine, and then the Benzodiazepine. And for me, it was the brand name Ativan. So I didn't take Lorazepam long because I broke out in hives. So I needed the brand name Ativan. So for 9 months I took that, but I mean, I could pretty much say right away, I mean, we're talking people like within 1 month, neither of the drugs were helping. So Cymbalta failed, benzos failed. And, you know, it's sad because it, for a while, kind of covered up my symptoms, and you know, you're kind of fooled into thinking it's working, and you feel like, okay, maybe I'm doing something to help myself feel better and improve my health. But then in the end, you know, hey, I end up going through suicidal ideation and thoughts. I was slammed with serious challenges because there's a black box warning for Cymbalta, and there's a black box warning for benzodiazepines. And then I found out, almost like 2 years later, my pharmacist, she waited 2 years to tell me, guess what? You have too much serotonin in your system, and that's why you don't feel well. You might have serotonin syndrome, and you need to get off those medicines. Well, you know, it was kind of late in the game. I was already suicidal and turned away from the ER. So I went to the ER and I was suicidal. And regardless, it didn't matter what my symptoms were. It didn't matter that there was depression and all these symptoms of anxiety and fibromyalgia pain, insomnia, and so forth. The doctor didn't care. He sent me home. He didn't do nothing. And, you know, when you don't get the help you need and you're just handed one prescription after another prescription, and it's really just a Band-Aid, and it kind of covers up those symptoms for a while, and then it rears its ugly head somewhere down the line. And, you know, it could be months, it could be years. I mean, everyone is different. And, you know, as a little medical disclaimer, I'm just going to say I'm not a physician. I'm not here to cure you, diagnose you, or give you any kind of prognosis or any kind of miracle cures, people. I'm just a person who experienced some really negative situations, very life-threatening situations. I mean, I'm talking, I did have serious challenges with my central nervous system and what was going on with all these chemicals mixed together. And at the time, so back in 2009, there wasn't a black box warning, you know. So the crazy thing is, when I was first prescribed some of these drugs back in 2009, 2010 even, there was no black box warning for a lot of the drugs. And let's not forget, there was no informed consent. What that means is your physician does not inform you, the patient, of any details to do with negative side effects, interactions with other medications, dire implications, and black box warning. Many doctors do not give you informed consent, which is BS. Because as patients, we have the legal right to know what we're getting ourselves into. And if there is not a black box warning or any of this literature in our pharmaceutical information that we get at the drugstore, or we go online on the websites, and there's no black box warning, there is nothing out there to tell us and give us like the heads up, we don't know. So I did not know. You know, so many people, they love to leave comments like, you didn't have to take it. You know what? I wish I didn't take it. I wish I never took it. If I knew there was a black box warning back in 2009 and 2010, I guarantee you I never would have filled that prescription. But this is what I'm getting to, is that doctors are not informing patients about these meds and about the black box warning and about the suicidal ideation and about the physical dependency. And another thing too is, let's not call people drug addicts, because I'm getting kind of ticked off at those who are leaving these crappy comments. Black party, I'm gonna block you people. You can comment all you want and it's not coming through. So any nasty comments, you could consider yourself adios. But there's many people who say, oh, someone's just addicted to drugs or they're misusing drugs. This is bullshit. It's prescribed harm. We are following doctor's orders. The doctor says, this is your milligrams. You're going to take this once a day. You're going to take this in the morning with breakfast. We follow their orders, people. Okay, so let's not start calling people names and calling them drug addicts when you don't know the whole damn story. I get so ticked off at you. I mean, I could laugh now because I could look back now and I could laugh. I mean, this is like progress for me to be able to laugh at this, because I wasn't laughing. Okay, let's keep it real. In 2009, 2010, 2011, 2012 and onward, I was not laughing. I was crying. I was suffering. I was on my deathbed. I became suicidal. I overdosed, and I'm fortunate to be alive. But many people would rather, instead of hearing your story or really listening and having compassion, having empathy, and just being a very kind-hearted person, there's a lot of people, they're, complete idiots, and they want to just tell you, accuse you of being a drug addict. I was not a drug addict. Just like many, many, many other people in the Benzodiazepine community and the opioid community and the Cymbalta community and all the other psych drugs out there, many of these people were just doing what the doctor ordered us to do. And we didn't see nothing in our pharmaceutical literature or online within the websites to warn us about the consequences of these potent toxic chemicals. And so if there's nothing else I learned, it is that medicine can mask the problem, and it doesn't always help. It may harm you in the end, and that I personally believe, while there is a time and a place for medicine, because there most certainly is, especially if you do have a heart condition, diabetes, or some horrible disease, but we have to understand that there's always other options. Medicine is not the first or only solution. We have to be open-minded, people, and look at the big picture. There may be things we could do for that diabetes or that heart condition and that high blood pressure. We might be able to change our diet, maybe get a little exercise. Get off the couch, people. Get yourself moving and grooving, okay? Because we know, no matter where you go online, you will see it over and over that our lack of physical activity and our lack of clean, healthy nutrition will definitely have a significant influence on our body, mind, and medical conditions. Therefore, with my fibromyalgia, I'm at this point where I'm 9 years free of Cymbalta and 8 years free of benzodiazepines and all the other meds. And so I learned, and it was a hard lesson. Hey, I didn't learn the easy way. When you go through hell on earth with the benzo withdrawals, trust me, that was not the easy lesson. But I learned. And what did I learn? That medicine can mask the problems, and it's not always the solution. And that it can actually cause a lot more harm and a lot more destruction. And you could lose so much. But there's beauty in rock bottom. There's beauty in rock bottom, people. The beauty of rock bottom is that the only way to go is up. And for me, going up meant taking a good look at my life, taking a good look at my health, saying, you know what? No more meds. No more meds. No, let's just clean up the life, clean up the health. Let's skip the drugs and let's kind of go holistic. Let's eat a healthier diet, get out there to start exercising. And I end up getting involved in a fibromyalgia program that got me doing physical therapy, nice gentle stretches and walking and getting outdoors and getting that body in motion. And it really helped. I think that when we really start eating healthier and we start getting more physically active, it gets those good feel good endorphins going, people. You know what I'm talking about. Feel good endorphins. And there's a lot of different ways to get those feel good endorphins going. But exercise is one of them. And you don't have to kill yourself at the gym. A lot of people with autoimmune conditions, spine and back, low lumbar or neck conditions, or even if you have a messed up knee, messed up shoulder, you cannot go to the gym. Neither can I. I have to be careful. But the beauty is you could do, even if it's just for 15 minutes, going for a walk around the block, or just doing little gentle yoga stretches. Just stay off the couch, get up, get moving. Some people, even in their home, they pop on a CD that's like yoga or exercise, whatever, little aerobics, and they do what they can, even if it is only 20 minutes, whatever. Don't hurt yourself. Of course, be careful if you have a back problem, a back injury, or an autoimmune condition or a heart problem. Do what you can do, but consider that you could be the CEO of your health. And so today, if you don't learn anything else, learn that you have more power. You have more power than what the medical community wants you to know. You have the power to make positive changes. You have the power to empower yourself, to take back control of your body and mind. Start looking at the ingredients of what you're eating. Get rid of all those fake foods and fast foods and junk. Hey, I like to eat some, junk food too now and then. I'm not saying just never, ever, ever. I'm just saying on a daily basis, let's try to focus more on eating healthier. Let's get out there and exercise. Let's get those feel-good endorphins going. Do what works for you. And consider that the least amount of medicine you take could actually promote your health. And it could have this wonderful, dramatic influence on you and your future. And so I hope today that you learned something, and I hope that you could share with me if you yourself found out the hard way that medicine's not always the solution. It might cover up and mask those symptoms and medical conditions. So subscribe, share with me what's going on with you. Did you ever take any meds that messed you up? Did you go through wicked withdrawals? If so, how are you doing? Do you exercise? Do you do yoga? I'm just kind of curious what everybody's doing out there. And you could check out my website at danaarcuri.com. Have a wonderful day.